Post-operative bowel function enhanced by chewing gum, presented by Lupe Terrazas. Background and significance. Focusing on med-surg patients, I see many patients who have had abdominal surgery have a longer hospital stay and an increased need for encouragement and education. A common postoperative side effect is an ileus, where there is a lack of gastrointestinal motility that, if prolonged, causes pain, nausea, and vomiting. There have been studies to find interventions that will promote early bowel function, therefore decreasing the amount of time for the patient's first bowel sounds, first time passing gas, first bowel movement, and an overall decreased length of stay in the hospital. There are alternative approaches used to accelerate the return of bowel function. Early mobilization and early hydration is the standard of care in the hospital where I work. However, will chewing gum decrease complications, length of hospital stay, and increase satisfaction for an overall better and faster recovery? PICO question. Evidence-based practice clinical questions are formatted in such a way that will enable researchers to find the best and most reliable data. This form is the PICO format, which stands for patient population, intervention or issue, comparison, intervention or group, outcome, and time frame. My PICO question is, in patients who have had abdominal surgery, how does chewing gum compared to not chewing gum affect intestinal motility during the first 3 days after surgery? Search strategy. I began with CINAHL and found that the Boolean phrase, manner of looking key terms up, was useful and easy to do. My end search phrase was chewing gum and surgical patients. This gave me 10 articles, one of which was a cohort analytical study. For PubMed, I used the MESH search tool and combined surgical procedures, operative, and abdomen, and chewing gum. This provided 3 articles, one of which was a randomized controlled trial. Appraisal of evidence. The cohort analytical study I chose was Level 2 evidence. It was a non-randomized trial including 44 demographically similar patients. The experimental group had positive bowel sounds, the first flatus, first food intake, and first mobilization significantly sooner than the control group. In order to improve this study, I would recommend a larger sample size. Appraisal of evidence continued. The randomized control trial had Level 1 evidence. It included 240 patients of similar demographics who were placed in one of 8 groups. Groups varied from having no intervention, 1 intervention, a combination of 2 interventions, or all 3 interventions. The 3 interventions were gum chewing, early hydration, and early mobilization. The group with all 3 interventions had best recovery time. The group with all 3 interventions had return of bowel function at 4.95 hours versus 9.32 hours in the control group. I liked this study because it allowed me to see how each intervention independently affected the return of bowel function. Application. The intervention of chewing gum is easy to do, cost-effective, and has little to no side effects. Potential problems may be if a patient dislikes chewing gum, if patients have dentures, or if they dislike the flavor. Overall, patients and family would be happy to see an earlier recovery with less complications and less time needed in the hospital. Conclusion. The act of chewing gum will accelerate the return of bowel function for patients who have had abdominal surgery. Chewing gum in combination with early oral hydration and early mobilization may be best effective. An accelerated return of bowel function and recovery means a decreased length of hospital stay.